Hi, I'm Dr. Mary Barbera, autism mom and board certified behavior analyst. Many of you have seen my videos of Chino, who I worked with around 2010, I believe, when he was just 20 or 21 months old. He made amazing progress, and he is now in early elementary school with little support, and he is fully conversational. In fact, he's bilingual, Spanish and English, as this is what his family speaks. So when I started with Chino when he was just 20 months old, the family had an older child who was just a year or two older than Chino, and they had planned to raise their family in a bilingual home. And so they were asking me what we should do about this bilingual desire, and Chino really had only a few pop-out words and very few skills to speak of. I didn't have a lot of experience back then with how to teach bilingual families and how to select one or more languages. But I was pretty sure that we should stick with English because all of his early intervention providers were speaking English that were coming into the home. The other important part is that when Chino went to preschool and to school, he would be speaking English at school. And so I was pretty sure that we should stick with English, at least in the beginning, and we should pair the words in English. And if they wanted to speak in Spanish to their older daughter, in full sentences, he wasn't going to really pick any of that up anyway, so that we were speaking to Chino in very one-word, two-word utterances. So instead of saying, Chino, let's go up the stairs and brush your teeth and get ready for bed in English or Spanish, we would be saying up, up, up as we were climbing the stairs. And these are the techniques that really brought Chino's language up. Since starting my online courses in 2015, which has already served people from 45 different countries, both professionals and parents, there are a lot more families asking questions about bilingual, how to teach bilingual kids, especially early on. So I know that in general, research supports that kids can learn 2 or more languages very early on. But when you have a child with severe language delays and disabilities and autism, it is different in my experience. My experience is that we need to pick one language, and that language, in my opinion, should be the language where they're going to be taught in school, because that is the language that they're going to have the most exposure to, and the therapist you'll be able to find therapists in that language a little bit easier as well. For higher language kids, I know we have one member who started with my procedures very early on when I first wrote my book. She's in Switzerland, and there are 3 languages that her family and community speak. And she was on a call a few years ago with me and Dr. Mark Sundberg, and she was asking questions about 3 languages, and that her son, who was fully conversational and pretty indistinguishable from his peers, was better at one of the languages, and the other 2 languages were he was a little less competent in. And I suggested that she do 3 different VB-MAP assessments for the 3 different languages, and then she would be able to see which areas within each language needed to be caught up. So this has worked well for families, and I do believe that obviously more research is needed, but in the meantime, I think from my practice with hundreds of children over the past 2 decades, that I would stick with one language and And then as the child develops language, you can teach him the second or third language, hopefully. And if they become fully conversational like Chino, and they'll become bilingual at the same time or near the same time. And I think that will happen more naturally than trying to teach 2 languages early on. Hope you found this interesting. Leave me a comment on marybarbera.com, and I'll see you next week.